Tauten giant cell are seen in xanthomas. Complete wound strength is gained by never regained. Interleukin responsible for pyrexia is interleukin 1, and if it is not given, then interleukin 6. Which among the following is not an adhesion molecule? Transferrin is not an adhesion molecule. Integrin, selectin, and interferon are adhesion molecule. Resolution of inflammation is caused by none of these. Histamine causes all except platelet aggregation. So histamine causes arteriolar dilatation, increased permeability of venules, and constriction of large arteries. C in CRP stands for capsular polysaccharide of pneumococcus. Most characteristic feature of acute inflammation is vasodilatation and increased vascular permeability. Which of the following is not a labile cell? Hepatocyte is not a labile cell. Bone marrow, epidermal cell, and small intestinal mucosa is labile cell. Which of the following is not an acute phase reactant? Tissue factor is not an acute phase reactant. CRP, fibrinogen, and serum amyloid A is acute phase reactant. Rubor in inflammation is due to dilatation of arterioles. Principal cell in granuloma is histiocyte. Rubor in inflammation is due to dilatation of arterioles. Exudation of plasma and leukocyte in acute inflammation is from the venules. Immediate transient type of increased vascular permeability in acute inflammation venules. Epithelioid cell is a modified macrophage. The nuclei of Langerhans giant cell are arranged around the periphery. Epithelioid-like giant cell are seen in all of the following except Crohn's disease. So epithelioid-like giant cell are seen in leprosy, ulcerative colitis, and brucellosis. Immune granulomas are not seen in silicosis. They are seen in tuberculosis, syphilis, and berylosis. When leukocytes are arranged along the endothelium of blood vessel, it is called margination. The complex process of leukocyte movement through the blood vessel are all except phagocytosis. So the leukocyte movement through the blood vessel are rolling, adhesion, and migration. The four classical features of inflammation are described by Celsus. Macrophages are seen in late inflammation. Bradykinin is a cleavage product of kininogen. Vascular dilatation in the inflammatory response is mediated by all the following except leukotriene. So it is mediated by prostaglandin C3A and C5A. Which leukotriene is the adhesion factor for the neutrophil of the cell surface to attach to endothelium? B4. Chemotaxis is promoted by all except serotonin. So chemotaxis is promoted by lymphokine, kallikrein, and complement factor C5. Chemotaxis is mediated by leukotriene B4 and C5A. The most important mediator of chemotaxis among following is C5A. Endogenous chemoattractant are all except integrins. So endogenous chemoattractant are C5A, LIB4, and IL8. In lipoxygenase pathway, the formation of arachidonic acid products which of the following helps in the promote platelet aggregation and vasoconstriction? Thromboxane A2. Phagocytosis is not done by NK cells, natural killer cells. Histiocytes, WBC, and macrophages help in phagocytosis. Opsonin is C3A. Most important inflammatory mediator is tumor necrosis factor. In acute inflammation, pain is mediated by bradykinin. Phagocytic cells elaborate prostaglandin and leukotriene. The eosinophil secretes all except hydrolytic enzyme and eosinophilic chemotactic factor. So the eosinophil secretes major basic protein and reactive form of O2. In genetic deficiency of MPO, the increased susceptibility to infection is due to inability to produce hydroxy halide radicals. Integrins include all the following receptor except platelet derived growth factors. So integrins include fibronectin, glycoprotein on platelet surface, and leukocyte adhesion molecule. Regeneration is replacement of lost tissue by living tissue of similar kind. Myofibroblast is seen in wound margin. Angiogenesis is formation of the new blood vessels, which occurs first in wound healing. Neutrophil line the wound edge. The tensile strength of the wound starts and increases after 7 to 10 days. Laminin is present in basement membrane. Laminin and fibronectin are involved in all of the following cell function except apoptosis. So laminin and fibronectin are involved in adhesion, migration and differentiation. Keloid scar is made up of dense collagen. Highest concentration of hydroxyproline is seen in collagen. Wound healing is the summation of the following process except fibrolysis. So wound healing is the summation of coagulation, matrix synthesis and angiogenesis. Complete restoration of tensile strength of the wound comparable to normal tissue takes as long as none. Hemodynamics: edema is caused by fall in plasma protein below 50%. Increased blood volume in a tissue is known as hyperemia and congestion. Following injury to a blood vessel, immediate hemostasis is achieved by vasoconstriction. All the following occur in hemostasis except, so all these occurs: vasospasm of blood vessel, platelet plug formation, dissolution of clot by plasmin and formation of fibrin clot. The blood in the vessels normally does not clot because vascular endothelium is smooth and coated with glycocalyx. All endothelial cells produce thrombomodulin except those found in hepatic circulation, cutaneous circulation, cerebral microcirculation, and renal circulation. Platelet aggregation in vivo is mediated by Ig mediators, interaction among the platelet, and macromolecules. Thromboxane A2 is formed by platelet formed from PGG-PGFL. It is prothrombotic and vasoconstrictor. Which of the following is a procoagulation protein? Thrombin. All of the following are true about blood coagulation except extrinsic pathway is activated by contact with negatively charged surfaces false. What is true about blood coagulation? Factor 10 is a part of both intrinsic and extrinsic pathway. Intrinsic pathway can be activated in vitro. Calcium is required in several steps of coagulation. Fibrin is degraded by plasmin. Varicose triad for thrombosis include all except platelet thrombus. So varicose triad include stasis, endothelial injury and hypercoagulability. Arterial thrombosis is seen in homocystinemia, antiphospholipid syndrome. Inherited coagulation disorder is protein C deficiency, protein S deficiency and Leiden factor. Predisposing factor for venous thrombosis: 83 deficiency, protein S deficiency, protein C deficiency and dysfibrinogenemia. Inherited coagulation defect with increased coagulation is found in protein C deficiency, antithrombin 3 deficiency, protein C resistance and dysfibrinogenemia. All of the following conditions may predispose to pulmonary embolism except progesterone therapy. So which condition predispose to pulmonary embolism? Protein S deficiency, malignancy and obesity. Hypercoagulability due to defective factor 5 gene is called Leiden mutation. Which of the following present with recurrent episode of upper limb thrombosis? Prostatic carcinoma, pancreatic carcinoma and osteosarcoma. All are predisposing factor of deep vein thrombosis except subungual melanoma. So which are the predisposing factor of DVT? Cushing syndrome, hip surgery and lower limb fracture. All of the following are risk factor for DVT except age less than 40 years. So what are the risk factors for DVT? Duration of surgery more than 30 minutes, obesity and use of estrogen progesterone contraceptive pills. All are hypercoagulable state except none of these. So protein C resistance, protein S deficiency, antiphospholipid antibody and polycythemia all are hypercoagulable state. All increase the chances of DVT except superficial thrombophlebitis. So what increases the chance of DVT? Occipitals and hypertension and myocardial infarction. A patient with cirrhosis of liver has the following coagulation parameters: platelet count 2 lakh, prothrombin time 25 second by 12 second, activated partial thromboplastin time 60 second by 35 second, thrombin time 15 second by 15 second. In this patient, D dimer will be normal. The most common source of embolism is DVT. Which of the following is true of fat embolism? Thrombocytopenia and fat globules in urine. Leiden factor, factor 5, pale infarct are seen in all of the following site except lung. So Pale infarcts are seen in heart, spleen, and kidney. Pale infarct is seen in the following except lung. So, pale infarct is seen in liver, kidney, and brain. On sectioning of an organ at the time of autopsy, a focal wedge-shaped firm area is seen accompanied by extensive hemorrhage with a red appearance. The lesion has a base on the surface of the organ. This findings is typically of lung with pulmonary thromboembolism. White infarct is seen in liver. Hemorrhagic infarct may be seen in lung. In shock, characteristic feature is poor perfusion of tissues. True about shock, in early stage cardiac output and blood pressure are maintained. Renin secretion may be increased. Severe hypovolemic shock occurs when blood volume is less than uh, blood volume loss is more than 40%. Endotoxin shock is initiated by cytokine action. In gram-negative septicemia, early findings setting before shock of fluoride is increased cardiac output and increased total peripheral resistance. Early sepsis is characterized by all except bradycardia, sweating, and cold extremities. Cytokine are secreted in sepsis and systemic inflammatory response syndrome by neutrophil. In cardiac shock, systolic blood pressure is less than 90 mm of mercury. Peripheral resistance is decreased in which type of shock? Neurogenic shock and septic shock. The histological feature of shock includes ATN and pulmonary congestion, depletion of lipid and adrenal cortex, hepatic necrosis. Platelet dense granules contain all except VWF. White infarcts are seen in all of the following uh, except none of these. So, white infarcts are seen in liver, kidney, spleen, and heart. Edema is caused by fall in plasma protein below 50%. The commonest site of thrombosis is vein. Organ most vulnerable to ischemia due to shock is heart. Cells most sensitive to hypoxia are neurons. Which is the least resistant to O2 depletion? Heart. Primary causes of non-inflammatory edema include all of the following except increased vascular permeability. So, primary cause of non-inflammatory edema include increase in intravascular hydrostatic pressure, diminished plasma colloid oncotic pressure, and lymphatic obstruction.